it's long enough, if you have something wrong with it, because you cannot take it out. There's no way of removing toxin.
Welcome to Real Health with me, Karl Henry. Folks, you're going to enjoy today's episode, I think. Botox has become commonplace in Irish culture. It is everywhere. But what does it actually do? And where is it safe to get it done? To understand this popular procedure and everything about it and all the myths and everything else, I am joined by GP Dr. Farah Mydin, who's been practising aesthetics and Botox procedures for over a decade. Farah, welcome to the show. How are you?
Thanks for having me, Karl. Thank you. Thank you.
You're in sunny Donegal, huh?
Yeah, no. It's raining sideways here.
Is it fair to say that Botox and aesthetics, it is everywhere? It's so commonplace. It's so many people are getting it done. No one really has a clue what they're getting done or what they're not getting done, but they're going to do it anyway. It is very popular, isn't it?
Absolutely. It's got really, really, really popular as well, particularly in the last maybe 3 or 4 years. Even since COVID, when everything was lifted, there was just a boom of it. It just went crazy. Like literally everybody's looking for it.
And was that down to all the FaceTime and Zoom sessions we were doing and looking back at ourselves in the screens and seeing a wrinkle that we didn't like? Or what do you think drives that?
I think it's a combination of things. I think it's a combination of like the rise in social media during lockdown. I think it's, yes, your FaceTime, people are looking at their faces the whole time. And, usually when you're on screen in your laptop, you don't actually look great because of the angles you're at. Everybody's the same. So you become really hypercritical of yourself. The other thing was there was a boom in people providing botulinum, like anti-wrinkle injections, since the COVID, since all the bans in COVID had lifted. That was due primarily because during COVID, there was a lot of both online courses for injecting Botox being provided, especially in the north, and anybody could
online courses. No.
Online courses. Yeah, so you, Karl, could go online and become a Botox expert in 2 days.
How can you call it? Surely, by its nature, you're injecting something into somebody's head or skin or boobs or wherever it goes. You need to actually practice it, sticking it in.
Yeah, I mean, it's crazy. I mean, it is mind-blowing, but this was going on during COVID, and because the rules are different in Northern Ireland than it is here, it's getting kind of mixed up. So companies were providing certificates. When you have the certificates, you can get you can get insured with different companies to be able to inject toxin. And then what people were doing is, because you needed a doctor to prescribe botulinum toxin, they were ordering it online from Korea, from China. I mean, the HPRA was all over this. Like, it was crazy. It was just this massive boom. Everybody's doing it. Everybody's looking for this magic treatment. Might not necessarily be right for you as well, So it was a combination of things that just kind of cascaded into this,
Let's bring it back to basics then, okay? So what is it? So everyone hears the word, it's Botox, and even in our chat already, you've mentioned a few different variations on the word. What is it? That's the first thing.
Yeah. So Botox is a brand name that's actually no longer called Botox anymore. It's a brand name for botulinum toxin, which is a neurotoxin, and its function is to stop your muscles from moving temporarily. So there is a huge umbrella of neurotoxins. In Ireland, we use Vistabel, which took over from Botox. We use Azilure, we use Bocatur, so there's lots of different brands of essentially a neurotoxin.
Okay, and what makes one different from the other? Is it just the brand label, or is it the quantity of neurotoxin in it, or?
Yeah, so the most common used ones is Vistabel, which was Botox. It's just bought over by AbbVie, a different company. That is the most common one, and Azilure is another one. So it's the different chains of toxins. So one is slightly heavier than the other. So I would tend to use Azilure for someone who has really strong muscles or really hard to treat areas. So my that's my go-to. That's the way I use it.
Okay, and how is it administered then? So how does one administer it?
So you would, okay, first of all, Vestal comes in a powder. You'd have to dilute it to the right dilution, and you draw it up into a syringe and inject into the muscles that you need to treat. So you need to really have a look at the face, assess the facial muscles, see exactly where you need to inject, and then inject. So you need to, with injections, obviously you need to sterilize the face. You need to mark the areas. It has to be in a sterile environment because needle is piercing the skin. So, you don't want to do it in somebody's bedroom. It's just, it's just like you just don't do it. Like, and it's
Following on from that, then, right? So you're a GP, right? You're a medical practitioner. You know your science. You know everything. When it goes wrong, what happens then? So I'm sure that's the question people are asking. So say they do go to Mary down the road, who's opened up, a side business injecting Botox, who may have done an online course in Northern Ireland over COVID. What happens? So what can go wrong? Can you overfreeze? Can you put too much in? Do you get that kind of totally frozen? Or from listening to you, it's also very much almost in the eye of the injector in terms of where it goes.
Absolutely. So when it goes wrong, like everybody, my facial anatomy is different from yours. If I use a blanket template for injecting Botox, for me and for you, we're both going to get very different results. So, injecting a neurotoxin into some random muscle is going to cause either unintended paralysis of certain muscles. You're going to get facial asymmetry. You could get an eye drop. You could get lots of different, you can get infection. You can, if you buy an unlicensed product, we don't actually know what's in them. And those can cause issues because we don't actually know what that product is and how it's going to react to your muscle. Is it really neurotoxin? Do you know what I'm saying? So there's lots of things that can go wrong. You can get infection, you can get undesired results, facial asymmetry. Frozen foreheads. I don't know if that's the side effect. The side effect for me, I wouldn't want people to have completely frozen foreheads, but that
or an unevenly frozen forehead, like the right side is more frozen than the left. It's a slight problem.
And if that was to occur, that can occur even with with an experienced practitioner. That can be resolved, but you need to know how to resolve it. So your template that you get in a 2-day course is not going to tell you how to do that.
And how long does it last?
So let's just call it Botox to save confusion, okay? Because that's that's the name that everybody knows. So Botox takes about 2 weeks for it to kick in. So you can still use the muscles for that period. Some people, it'll happen between 3 to 5 days, but it can take up to 2 weeks. And then your muscle freezes. So our aim is to get the muscles to freeze. When it freezes, it stays frozen for a period of 8 weeks, roughly. And then your muscle slowly starts to come. Your muscle function slowly starts to return after that. So in overall effect, you might have a reduction in your lines for about 3 to 4 months, depending on the person.
Wow.
Yeah. So it doesn't last very long in your system, as in it's long enough, if you have something wrong with it, because you cannot take it out. There's no way of removing toxin.
So if you and so what you're saying is, so say for example, if I went to you, okay, and you told me that I needed Botox somewhere, which I will ask you that in a second if I should get it or not. Not that I intend on getting it, but if I was to come into you, and when I walk out the door, I don't know how it's going to look for 5, 6, 7, 8, 9, could be up to 2 weeks.
Yeah, that's unnerving for first timers, but if someone comes into me for a consultation and they're requesting anti-wrinkle injection, sometimes it might not be suitable for that person, so it's up to me to advise them on that. And if they are getting Botox, I'd always kind of go lower dosage and bring them back in 2 weeks to see how they are, rather than giving them the full whack and they're just panicking in 2 weeks. So you can gradually ease your way into it. There's lots of options and there's lots of way we can do it. But I've been injecting for so long that I can predict what it's going to do. So I can reassure the person, and I get Botox myself all the time. So I know how it feels. I know what it feels like waiting for it for the first time. I know what areas people are more sensitive in, so having done it myself and having done it for a long time, I'm able to kind of settle people down and point them to the right direction if Botox isn't the one for them.
And is Botox just for the face, or is it also used for like sweat glands and other things and other parts of the body?
So Botox, there's cosmetic uses for wrinkles. We also use it to relax the muscles, the masseter muscles for people who grind their teeth. We use it for muscle spasms in the neck if someone has really tense traps, or to just if you're really really tense, it can reduce the spasms that you have in your trapezius. We can use it for excessive sweating as well, because it kind of you can use that for under your arms, your hands, and your palms of your feet. So it works very effectively for that. It's also used for migraines. Migraines are a big thing. Yeah, migraines, amazing. It's a game changer for loads of people who suffer with migraines.
Wow.
Yeah.
You were saying there, that when you do the assessment, which is great, and that kind of, that real medical view that you treat each patient individually is fantastic. What kind of person wouldn't be suitable for who would you say you shouldn't be, this may not be the treatment for you?
Yeah, I think, since social media is constantly putting up, when you're looking at, you'd come in and you want to get wrinkles treated, right? If you have a lot of skin elastosis or skin laxity, when there's too much skin around the areas that you want to treat, Botox is not the answer, because Botox is a cosmetic treatment. It's not an anti-aging treatment. It's not going to treat your skin. It's literally going to stop the muscles from moving. So for that reason, they'll be wasting their money putting Botox into themselves, because it's not going to do very much. The skin laxity, the skin is overlapping it, is too loose, so you can't actually see the muscle tensing.
Fabulous. This is why we bring experts in. It's fantastic. You know stuff that people need to hear, which is exactly like this, which is great.
And sometimes it's like when they come in and I tell them, I'm sorry, I can't, and they're like, oh my God. But there are lots of options, with regards to skin tightening and skin resurfacing. So there's lots of anti-aging treatments. But as you know, you're a PT, everyone wants a quick fix, right?
Of course.
Including myself. Botox is your quick fix. But to treat your skin, to recondition your skin, to make it tighter, it requires it requires commitment and a little bit of downtime. And it can be done, but it takes a bit more time and patience.
Chat to me then about aesthetics and the difference between Botox and aesthetics.
Botox is, well, I suppose Botox is an aesthetic treatment, but it is just a cosmetic treatment. So it will improve the visibility of your lines. It'll, stop you from frowning. It'll reduce the visibility of the lines in your forehead and crow's feet, again, temporarily, but that prevents the deepening of them lines. Do you get me? If you get regular Botox, you're not going to be moving those muscles as much. Therefore, the lines are not going to get any deeper. So it is a cosmetic treatment. Other aesthetic anti-aging treatments would be the likes of anything that would stimulate collagen. So in clinic, we use a lot of radio frequency microneedling, and we use CO2 laser resurfacing, and we actually use a lot of BBL, which is not the Brazilian butt lift. It is.
I'm glad you said that and not me. I was going there.
I got ahead of you there, Karl. No, the BBL is actually great anti-aging treatment, because this is the difference here that I want you to understand, is I'm quite passionate about this, okay? When you age, you get a lot of pigmentation in your skin, you get broken capillaries in your face, you have a lot of skin laxity. And when you get the BBL treatment, which is light-based treatment, it lifts all the pigments, gets rid of all the broken capillaries, and also you can get collagen stimulation with it. And that was actually looked at and published by a Stanford study, where if you get 3 BBL sessions per year, it actually alters the gene expression of your skin to mimic one of younger skin. So,
and bring us into collagen for a second then, because you mentioned it a couple of times. So collagen is really important for your skin. We have it.
Yes. We have collagen, but for women, as we get older, we don't produce as much estrogen, and therefore our collagen stimulation goes down. So we are relying on external sources to get collagen stimulation as we get older. It's a man's world, really, isn't it, Karl?
Well, until you tell me I need to come see you in Donegal, but yeah. But are men, that's a good point though, in all fairness. Do you find that more men are coming to you now, or is it still predominantly female?
I think the taboo of men getting treatment has reduced significantly. We do treat a lot of men with regards to rosacea, acne, improving their skin tone. We do have cosmetic treatments as well. Hair loss injections using PRP, migraines, anti-wrinkle, not as much, but certainly more now than when I first started injecting.
Okay, so I suppose it's normalizing on a societal level.
Absolutely.
And do you have, the way in the world of kind of obesity and gastric banding, and hair loss, actually, there's a Turkey trips. People jump on the plane, they go to Turkey, and then they come back, and then their GPs are left to kind of deal with the mess.
Yeah.
Do you get much of that in the aesthetics and the Botox world?
What I do have a lot of people coming in after getting hair transplants in Turkey, and they're getting their PRP injections to supplement their hair transplants. Now, in fairness, I personally haven't seen any bad jobs being done so far, bar one person who actually had a breast lift, tummy tuck, and
that was on RTE. I saw that. That was called not that person, but there is a particular treatment that you get 3 things done in one. It's a 3-in-1 job.
It's crazy because they're really limiting your blood supply and your healing. But she had really bad keloid scarring all over the places she was treated. So I was treating that because nobody would touch her from a public hospital point of view.
Of course, yeah.
Which is, it's horrendous, in a way, but it's also, there's a balance, isn't there? Like, it is, a lot of people can't afford cosmetic treatments in Ireland because they are so expensive, and I suppose that's from your licensing, our insurance, all our products has to be EU certified,
And for Botox, what's the range? I'm sure it changes depending on what part of the country that you're in, but what's the kind of price range for Botox treatments?
Yeah, so price range, I kind of try and keep it as fair as I can. I don't overcharge by it, I don't think, anyway. But so if you're getting one area treated, it'd be about €180, and if you're getting 3 areas treated, it's about €300. That would be my kind of ballpark figure. So your 3 areas would be your frown line, your forehead, and the crow's feet.
Okay, and again, for that you're getting 8 weeks worth of 8 weeks worth of improvement.
No, you'd get about 3 to 4 months. When I say the 8 weeks, your muscles frozen for the 8 weeks, but your functionality of your muscles slowly returns for another 6 to 8 weeks after that. So it's not a quick jump up and down. Now, there's also another school of thought about Botox and injecting per area. So there are advocates for whole face Botox, where you get Botox everywhere.
Oh God, okay.
I don't know how I feel about that yet. I can see how it would be good to kind of keep your skin looking the same. But if we put too much toxin in, if we use too much Botox, we're forgetting about our collagen stimulation, our collagen induction, our skin health, then you might get a lot of areas with skin laxity and areas that are not moving, and it's a bit of a mismatch. So you just have to be careful for that. But that's just in my opinion now. I don't want to get shot for saying that.
No, it's great. I think we bring experts into the show, which is important. And you are a medical GP who's an expert in this area with over 10 years experience, which is great. And I think from our chat, people will get that if you are going to get this done, you don't want to go to to Mary, who has a little shop in the corner. No offense, Mary, if you do have a shop in the corner and you're listening in, but she is fictitious. But you want to go to someone who will sit down, have a consultation. They will look at your face. They will treat you as an individual. They will give you what you need. You know, they will recommend what you actually need as opposed to that one size fits all approach. To finish then, let's just chat me through some general skin tips for people who are listening in. They're sitting in the car, or they're at home, or they're out for a walk or a run. They're all now going to check their crow's feet when they go home, myself included. But bring us through some really simple takeaway skin health tips then as well, while we have you.
I think in Ireland, everyone forgets to put on their SPF because it's not sunny. Your SPF, if you don't use SPF, there is no point in getting any skin treatments. You know, I say this to all my clients because you're just going to promote the aging of your skin. So if you want to keep it really simple, you know, make sure you cleanse your skin. Make sure you put on an SPF. Simple, you know, but for anti-aging or like for treating different skin conditions, it varies very significantly. And, you know, I wouldn't want to confuse the audience by saying everyone should be on retinol, everyone should be on like hyaluronic acid. You know, it all depends on the nature of your skin. You know, if you have a compromised skin barrier, if you have acne, if you want to treat hyperpigmentation, or if it's just basic anti-aging. So yes, very much individualized. And one thing I would say is retinol is great for anti-aging. It is amazing, but there's such a huge range out there. Like if you go into Boots or you go anywhere, there's loads of different types of retinol. Which one's going to work for anti-aging? This one tip I will say is when you look at the ingredients on the back, if it says it's retinol palmitate, that's the weakest form of retinol. So it's going to give you an antioxidant effect where your skin's brighter and better, but it's not going to give you the anti-aging benefits.
Amazing. People are going to be happy out. They're going to be looking younger by next week by listening to today's episode.
I know, it takes time and consistency.
I'm only messing. So, Farah, if people want to follow you online, where can they find you?
Yeah, so I'm on Instagram mainly. I tried that TikTok thing and it's just not me.
I've tried it too, and I turned it off after about 2 days. I couldn't handle it. It's just I don't dance, I don't sing. I'm like, no, I'm too old. At the right body, I'm 42, but my skin looks about 25. Is what you're secretly telling me. I know that.
You got that message, didn't you?
I did. So your Instagram handle?
It's Dr. Farah Mydin.
Amazing.
And my clinic is called Medical Skin Clinic, and you can have a look at it on medicalskinclinic.ie.
Farah, it's been great to catch up with you, and thank you so much for joining us today and telling us all about Botox and everything that we need to know. Folks, I really hope you enjoyed today's episode. Some really important content there, and we're delighted to have Farah join us on the show. As ever, you know where we are, at Karl Henry PT on Instagram, Real Health on independent.ie. We'll see you next week for more Real Health. Slán go fóill.